Hey everybody, welcome back to another episode of Luna Unscripted, where we talk about real life, real career paths, clinical insights, and just share the nitty-gritty details of life as a PT. I'm Katie Wiley, one of your hosts.
And I'm Joe Valdez.
I'm Marcy Arenas.
Well, welcome back this week, guys. I have a fun radio little segment that I heard this morning I wanted to share with you guys, which is kind of exciting in the world of PT. Now I don't know where their sources are, so I can't tell you, but they were talking about jobs that are like AI proof. So jobs that, won't get replaced by AI. I think that's a concern for a lot of people nowadays. But what are some of the ones you think would be not replaceable? Just out of curiosity.
I mean, I would throw healthcare professions out there, like surgeons, definitely, dentists, PTs, and maybe some of the engineering ones too. The plumbing and the electrician, those types of jobs definitely as well.
Yeah, you guys are narrowed in. So I forget exactly the ranking of all of them, but psychologist was on there. There was construction manager, the one running the project, which I was I didn't even think about that. But yeah, nobody else is gonna, replace that. Plumber, things like that, more of the trades. And then they had dentist, surgeon, and number one was physical therapist. I was hey, all right, we're safe. I was excited.
Number one, that's awesome.
I know. I don't know where their source is, but I felt good about it. I was all right, somebody out there, PT is not getting replaced. So I thought
it makes sense a little bit. I mean, there are AI things that can come out to help PT, but I feel like manual work, teaching people exercise, hard to do, especially manual work is hard to do.
Right.
Using
well,
AI.
I'm thinking a post-op rotator cuff. Family members aren't doing what we do. No. I always it's not the same. Yeah. Okay. So on that kind of token, today we're going to talk about some of the dollars and cents of physical therapy. So the cost of PT school, dealing with student loans afterward, average salaries, things like that. So just kind of getting into the monetary side of PT, what it costs to become a PT, and then afterward too. I know PT school's expensive, right? We have to do undergraduate, but then we have the doctorate program as well. I think most programs, is it 3+3 commonly now, or more 4+3? With the undergrad and doctorate. I know my program was 3+3, but I think it was a little unique.
Yeah, I think most are still 4 and then 3, but then you get some of the accelerated programs like yours, the 3+3, or even the 4 plus 2.5 if they want to graduate in December or something. But I still use 7 as my common number when I explain to people that ask about it.
Yeah.
Same. I do think it's it is becoming more common to have accelerated programs, anywhere from 2 to 2.5 years. But I think most programs still average 3. And maybe the ones that tell you accelerated that are 2 or 2.5 are accounting for clinical rotations after. And so they don't build that in.
Okay.
Mine was 3, but every rotation was done before the last semester of actual didactic work.
Got it. Yeah. Well, I did some digging into just the PT program specifically. So this is not accounting for the cost of undergraduate degrees or anything like that. And I was looking around, and what I thought was so interesting, and I feel this is stuff that's come up that, we've seen online, it's just the range and cost of PT school. Obviously you want to go to a PT school that fits what you're most interested in. It feels like a good fit in regards to size of the program, the instructors, their styles and their values. But goodness, there's quite a large range. So I did some rough digging here. I'll pull it up. The one I probably trust the most, there's an APTA kind of guide on it, total cost of education, and it has a pretty wide range. So I think on the lower side of things, there's definitely, so Army Baylor, that's a program. I think, how does that work exactly? If you enlist, then they cover the cost of your education. Is that how that typically goes? So obviously that's one of the more affordable ones. But it has, and again, this is going to account for, there's a column that has in-state student cost for the program as well as out of state. So outside of Army Baylor, on like the lighter side of things, we have some programs that are between like $11,000 and $27,000 for the whole cost of the program. And I'd say generally on this kind of lighter, less expensive side of programs, that's pretty inexpensive, but they're kind of between 30 to 50,000. That seems pretty good, pretty affordable, I think, for, you know, most programs being 3 years. And then we go all the way up to the higher side of programs, and it is quite the discrepancy. So just looking at this list, there's you know, they're between $200,000 to $300,000 for the cost of the program. And again, that's not accounting for like cost of living, you know, room and board, food, all of that other expense that you have when you're, you know, living as a student. So I thought that was really interesting, and I'd love to hear your guys' take on it, you know, that financial side of things, how much to factor into like program quality and kind of how that impacts us. So share your insights on those things.
Yeah, I mean, I think those numbers, you know, definitely a wide range. And I, over the past few years, have noticed a lot more for-profit schools popping up that are really just trying to crank out students and charge whatever they want for profit, which is kind of sad. But at the same time, we do need more clinicians. So, I mean, it's kind of a double-edged sword. But yeah, on the cheap side, I would definitely look into like the state schools. Those ones are generally going to be the ones in that probably 30 seems low, but let's say 30 to 60 range. I was lucky to get into a state school that, you know, was in that range, there, probably like the 40s range. So definitely lucky there. But on the private side, there's schools that are, you know, 100 to 200,000, you know, tuition. And then you take into account the cost of living. If you're in a big city, then that's going to be higher with room and board, plus
There
all
were
the
some
supplies
close
that
to
you have.
300,000 on that list. I was like, wow.
That's insane.
Baffling. Yeah.
That's insane. Definitely expensive there. But yeah, you have to take into account all the other expenses that you have, like cost of living, supplies, and then also like clinical rotation. We'll probably talk about that in a little bit, but those aren't paid. So there's extra expenses for that as well.
Yeah, my school was about 95 just tuition. And so my parents paid for room and board and all the cost of living stuff while I was at school. But the friends that I had that needed to take out loans for everything, it was about 150 to 175. And this was over a decade ago. So I'm imagining that it has gone up since then. But I think when I was looking at PT schools, sure, I did research a little bit, but I didn't know what I was looking at or looking for. The big thing in my world, and I know this is, I think, different for you, Joe, I'll be curious to hear Katie's. I didn't want a dissertation or like a final summit, thing that I had to do at the end. And I think your school you guys did that.
Yeah, we did have to do some sort of like research presentation. Some people spoke, most of us just did like a poster board with all our results. And then we did have scholars or like people of the field like coming in, and like we had to like do little mini presentations for them. But it really wasn't that hard. Like we spent pretty much our whole last year doing all that stuff like slowly. So it wasn't as bad as it sounds.
Yeah. And I've actually been to that school at different locations and had been the like clinical person listening to them. And so now on this side of things, I'm like, I could have done that. But as like an undergrad looking at when you see those big words, you're like, I have to write a 300-page document on like a PhD dissertation. So I chose a school that didn't do that. But other than that, I didn't know what I was looking for, or like to choose, okay, this one school is much more expensive than this school. Why is that? In your young minds, and sometimes even with other professions, that could mean quality. I now, with some experience behind me, don't believe that's true in a lot of cases, though it's, I'm sure, still the case for some things. But it's definitely something where I encourage anyone looking at going into any program, but PT, to really do some digging and investigation and things like that. Clinical rotation wise, my school had rotations across the country, in Europe and in the Caribbean, versus I know some programs really want people to stay local. And so they have them maybe in the same state, or most of them in the same city. So that's also something good to look at. That changes your costs. I was in Seattle for a clinical rotation for 8 weeks, still paying rent in St. Louis, and had to find somewhere to live and get around in Seattle. And then also same thing in Memphis, DC, and outside Chicago. So those are all things to consider when you are looking at schools.
For sure. Yeah. I think with clinical rotations, it's definitely fun to explore other areas, right? I was on the idea of planning mine related to where I had somewhere to stay. Because, cost was a concern for me, even going back to choosing a school. Part of why I chose the school I went to is because I got very good scholarships there. Like that was worthwhile for me. So I didn't have to take out a lot of student loans. You obviously want to make sure it's a school that meshes with you, what you're looking for. I did not have to do the dissertation at the end or any big program like that. It was unique in that I made my choice when I was going into college initially, because like I told you guys previously, I had that 3+3 program and I had direct entry into that. So yeah, I think take into account what you think is best for, what you're looking for in a school. But I question whether that will make a big difference as we get out of school. And I know we'll talk about that here in a little bit. But for me, I was definitely very scholarship driven, and I was looking for a place where I would not have to have a lot that I would have to take out. So I was fortunate to find the school that I did. But yeah, clinical rotations. Let's talk more about that. So obviously we have where you're living, we have food, we have travel, all of those type of things. So as we were mentioning, maybe finding somewhere where you can stay with somebody. What other tips and tricks do we have, or things that worked or didn't work for you guys?
Yeah, I really like Katie's suggestion there, and I definitely use family for one of my rotations because we had to do one that was outside of like a 100-mile radius from the school. So you pretty much have to leave to a different metro or state, and so using family to stay for that free room and board. Hopefully, I know not everyone has a situation, but that helps out. But I thought just getting some variety in like rotations, just on the educational side, was super helpful. I knew I was going to do outpatient, but I did want to get exposed to some other settings. So I did do one in acute care ICU and then another one in inpatient rehab to get those out of the way.
You were required to do those, right? Like for us, we had to do some in certain categories. Like I think we had to do one in acute care, one in outpatient, and we did inpatient rehabilitation. And then our last one, we could kind of choose whatever area we wanted to go in. So I did my other one in outpatient too.
Yeah. So I think we were mainly just required to do one neuro type rotation. And then the acute care one was an optional one. They said, if you're going to do outpatient, just do outpatient instead of acute care. And then the last two were, one was outpatient ortho required, and the last one was of our choice. So you really had the option to do 3 to 4 outpatient and then 1 of the neuro. So I chose to go the other way and have some other experience, which was nice. Yeah. But I think something that people don't think about when they go into these rotations is, on top of those costs that Katie had already explained, you're still paying tuition. So you just kind of have to budget for that. There's still tuition that is being paid for the cost of that, education, because you are getting educated. Getting that.
Yeah. Side note on that. So my husband, we've been dating and together a long time. So we knew each other going through college. He's an engineer. Engineers, we have clinical rotations as healthcare professionals. Engineers have co-ops. With co-ops, did you know that they are paid pretty generously for their time working as a co-op? That was something I remember being salty about as he was going through school. And then, when I'm on my little clinical rotations, I'm not only not getting paid, but I'm having to pay in order to complete those clinical rotations. I know they're different fields. I know there's a lot of training that goes into it, but I'm couldn't pay us a little bit, or at least make that, free to us during that time. Just a side thought, just throwing that out there.
Same. My husband's an attorney. We met while he was in the middle of law school, and they're kind of, it's not rotations, but what they do is similar to what we do, though it's not necessarily required in different fields. But he got paid while he was doing them over the summer, things like that. Did it happen to you guys when you were in rotations where you had a patient make a funny comment or something about getting working and getting paid or something, and then you said, actually, I'm paying to treat you right now. Like, it's not even just free labor. I'm paying to treat you. I always enjoyed that. Or kind of educating people on our degree, because I had a lot of people being like, oh, did you get your degree off the back of the cereal box type things. So, but looking into the rotate, we had to do one acute care and one outpatient, and then you could choose the others. I think I said this on a previous podcast. I really like Joe's model of picking different varieties. I was very also set on I'm doing outpatient, and I did 3 of the 4 in outpatient, but they were specifically chosen where they were. One was like cash based, very like one-on-one only. That was the one in Seattle, shockingly. They got on that cash base real early. And then one was kind of more geared towards sports and kettlebell training. So they were a little bit different than traditional. But yeah, I would have wished I would have learned a little bit more in them.
I had some clinical rotations pretty early on, actually, where I was seeing like the bulk of the caseload. And then they were kind of utilizing that to like, let's add some extra patients to the schedule, because, you know, then they had the opportunity to treat too. So in those situations, I'm like, I feel like I could have been compensated for that extra revenue source I was bringing in. But I think that's for all healthcare fields. We all deal with this, right? Physicians, occupational therapists, other types of healthcare too that deal with the same thing. So larger problem, but just a side note on the monetary side of things. What else? Anything else with clinical rotations?
I do think not with clinical rotations, but in general, what we're kind of talking about, keeping an eye on what's happening with changing our profession from like a professional degree, and how much in terms of student loans you can actually take out and things like that. Aside from the political piece, either direction, trying to lower at least the cost of education isn't a terrible idea. So I do wonder what that will look like in the next decade, or if that would change back or whatever, but what that would look like in the next decade. I do feel like some of these for-profit schools, like Joe said, are taking advantage of the fact that there is a lack of supply of physical therapists, and they can every trimester, every semester enroll them. I don't remember if you guys remember while applying, but like you got waitlisted from it was hard to get into PT school, and I still think it is, but they're taking advantage a little bit of that and just accepting people so that they can pump them in, but they can charge whatever they want because of that.
I mean, I think the stat around the time when I applied was, about 10-ish%, I think we're getting accepted, which, is pretty exclusive. I don't know what it is now, but, it almost seems like it's probably changing, right? Since there's more schools and, the supply is needed. So I'm not really sure, but I'd be interested to know that.
Well, yeah, let's talk about student loans specifically. So you're graduated, it's time to start paying things back. What does that look like? What are the payment models? And yeah, share some insight on that. I know, Marcy, you've done some digging on that.
Yes, it's a good peace of mind topic, because I've been getting emails from the federal student loan company, studentaid.gov, about changing the income-based repayment plans, and then I have to sign up and things like that. So number one, I don't know about you guys, I signed my name on those documents. I didn't pay attention to a single thing like relative to the amount or like what interest was or things like that. I had private loans through like a bank, and I also had federal loans through the government. I didn't know the difference between either of them. And I should have gone, at 18 or whatever age you are, 25 or 23, whatever age I was, you still don't really have an idea of any of that. And my parents are both accountants. And so they might have, but no one specifically told me like what that looks like. So I think you graduate and they give you a period of time, because most of us study and take the board. So I didn't have to start paying back on them for 6 months. And again, in that time frame, not at all thinking about it until you get like a email now or a letter in the mail, like saying what you owe and stuff like that. So the number one, biggest piece of advice is, if you're like us and you didn't pay attention to it beforehand, like we're talking to probably a lot of PTs and not necessarily people going into PT school, but it's understand what you're owing. I'm one of those people that don't love checking the mail because I don't like looking for bills, because I don't like to review them, but it's really important to look at what your loans are, and then how the interest works with the percentage. Is it fixed or is it variable? Things like that. So federal government, if you have federal loans, does have a really good website that will help you kind of calculate different payments and go over different options. I don't remember if it was the same for you guys when you were out of school, but one of the big things people wanted to do was the loan forgiveness options. If you did like 10 years in a nonprofit sector, the issue with those is, and it still happens, you have to, if you're going to do that, be paying under certain models. You can't just pay under whatever model of repayment there is. So you really need to specifically look into that. I worked at a nonprofit for 8.5 years. And I think it was only after like year 6 or 7 that I realized the payment plan I was on did not count towards the forgiveness option. So just because you work for a nonprofit and you have student loans does not mean that you are actually into the forgiveness program. You have to be paying on one of their specific plans, which generally tends to be higher monthly payments per month. I was always on the pay the least amount you possibly can track. And so those do not compute. And you can calculate all kinds of different things, but there's generally about fixed payments that keep the same amount no matter what. There's payment plans that change through the course of like 10 years. They start off low and then they slowly go up, assuming that your income goes up, which, as we know, as PTs doesn't, or in the medical field, doesn't necessarily translate. And then what I feel like most people look at are the income-based repayment plans, where they look at your salary and your tax returns, and then they do a repayment plan based on that. You do have to apply for it basically every year because they want to make sure your income didn't change rapidly. It does tend to increase your interest that you owe because it pushes out how far you have to pay. In the course of the last 10 years of me paying, I've been in 3 different repayment plans because the government can change it. And so you're on different ones and you have to pay attention to that. And for the last couple of years, I've been lucky or unlucky, but one or the other, to where I haven't had to pay anything because the loans have been in deferment because that's held up in the courts, the different types of payment systems. So since COVID, I think I haven't had to pay on loans. And for about 3 years of that, there was no interest accruing. So it was just kind of like, all right, let's party. And then it all came crashing down. Their interest is now accruing on all of those loans, even though they haven't fully settled it in the court system. And so if you're not paying on them, your interest is accruing. So your interest is accruing, and I have to now, by July 1st, pick a repayment plan option and supply my income taxes. So I would encourage people to do their research on these things and really pay attention to what they can afford with what they're making and how long they want to repay their loans off. The new plan that I have is if I make payments for the next, I think it's 15 years, at the end of that time, the rest of the student loans will be forgiven. So whatever amount I have will be forgiven, but you have to pay taxes on that, and the tax percentage is decently high. So you have to know that in 15 years, I'm going to owe this amount in my taxes.
Yeah, man, I feel like, so as an 18-year-old, I did not have a grasp of just finances. That I feel like that's such a big decision that we put on our newly formed adults in all different fields, going into college, but taking out these loans and just having a grasp in real life, like what that looks like. It can seem just like a fake number, right? When you're like, oh, I'm just taking this out, but without actually thinking through or collaborating with a family member and adult about okay, this is what this looks like. This is your potential, earning potential. And then this is how it'll affect your daily life. But yeah, obviously a lot of us have already gone through that and, are dealing with those loans. But I feel like I would encourage people just starting college to really better understand that and look into that. And now as a parent, I'm like, how do I teach my children financial literacy early? It's just, I feel like that's something that so many people need, and especially as it pertains to college and the loans that we take out with that.
Absolutely. And I'm a big believer that this should be instilled in high school curriculums, just financial literacy, not just on loans and the interest on that, but also things maybe mortgage versus rent, those types of things on taxes
versus buying a car.
Exactly. The point of that, and how to file your taxes. I mean, those things are things that you just have to learn on the fly. And if you
How
don't
to
have
save
parents
for retirement. I feel like there's just so
Exactly.
many people who aren't saving for
Credit
retirement.
card.
Oh my gosh. Like I have grandparents who lived into like their 90s and one lived till 100. So I'm like, I need to save. Like, I don't know what this is going to look like longevity wise. So like day one, all right, I'm saving into retirement because yeah, I don't think anybody plans or wants to work until they're 65 or 70 or beyond that. So well, let's talk about earning potential. Joe, I think you did some digging in that, kind of maybe base and average incomes in different settings and what PTs can expect there. And I'm sure some of it varies state by state too, right?
Absolutely, yeah. And I did some digging from a couple different sources here, but I did want to add one more thing on Marcy's student loan thing. Is I'm sure if you're in the PT world, you've heard of the changes with the government on the limits for student loan for graduate programs, and PT is now not classified as like a professional degree, so there's limits on how much you can take out in loans. Have you guys heard about that? Read about that?
Wow, like
Yeah,
it's
so
not classified as one that you need to have. Wow, that's surprising.
They only kept, I think it's what, physician, dentist, I think they kept chiropractor, lawyer, and psychologist maybe.
Well, just the fact that you like are literally not allowed to take the boards unless you complete said program. That's interesting.
Yeah. So it's just semantics, in terms of classifying, but what it does is it limits how much a physical therapist graduate student can take out in loans. I think it's like $20,500 per year up to like 100,000, which according to Katie's, information she shared earlier, the law programs are well over 100,000. So to bridge that gap, you have to go private loans, which the interest rates can really vary. So that's kind of a bummer there, but definitely for people looking into PT, look into those numbers and look into what your cap is and what your cost would be. So you know that you're not digging yourself a hole down the road. But that being said, let's talk. Yeah, like Katie said, I did some digging on average salaries for PTs, which definitely can vary state by state and your situation. But before I share that, I think some advice that I've heard from people and kind of online as well is your loan, and this is tough in PT. I think the ROI isn't a secret that it's harder than, not as great as some other professions, but they say try not to go much past like a year's salary as a PT, which I'll talk about the average, but that limits a lot of programs that you could be getting into. But my sources here, I have a couple different ones. I use BLS.gov. I think they're a really good kind of source for finding average salaries for a lot of different professions. But I also use a guy named Ben Fong. He's done something for the past 10 years called the Job Market Pulse. And he surveys a lot of different clinicians and takes those averages himself. So it's more definitely like self-source, self-research for salaries, but I found it to be very helpful, and he kind of breaks it down to different categories as well. But BLS.gov, and these are all a little bit dated, it usually takes a year or two to kind of get these averages. So I think these are from 2024. But BLS.gov, the average PT salary in the US was stated at, or quoted at $101,020. So right about that $100,000 mark. And then it broke it down by settings. So the higher paying settings were home health, SNF, and then hospital-based settings. For home health, the average they reported was about 108,000, which I thought was lower than what I expected. But average SNF was about 105,000, and the hospital setting as well about 105,000. And then on the lower end were the outpatient offices. So outpatient ortho, unfortunately, falls into that category. Probably outpatient neuro, those types of settings, but they reported them at around $94,000 average salary. Now I know new grads can definitely come in a lot lower, and then other practices can charge or can be higher. But a couple other cool stats from BLS.gov were the highest 10% of earners were earning over $132,000. I'm assuming these were probably more private practice owners, maybe like cash-based practices, those types of things. And the lowest 10% were earning less than $75,000. So we're thinking new grads, people kind of
Yeah,
taking
that sounds
advantage
about
of it.
right for new grad, right? I'm like, I
Yeah.
remember coming out and I'm like, oh, this is the outpatient salary. Like, I mean, you look into it ahead of time, but like when you're actually getting offers from places, because I had a few different offers, and you're like, okay, this is just what you do. And then obviously you get raises and things like that. And then I know my company that I started with had quarterly bonuses, right? You know, based off of your different standards, productivity, all of that.
Yeah. Yeah. So definitely look into that, and the bonus structures can offset that a little bit. But as a new grad, you're probably not extremely productive to qualify for a lot of this. So something to think about there. But that was BLS.gov. The job market pulse, which was by Ben Fung. Same thing. This is a couple of years old, but this is just a survey of a bunch of different clinicians. His average came out a little bit lower at about $96,000 for the salary. And then he actually categorized it into top 3 paying states and lowest paying states, and then also like top settings, bottom settings. So
can we
the top
guess?
3 things-
Can we guess what are
Yeah,
the
let's
top
see.
paying and the low?
What-
Yeah.
what-
Okay. I'm gonna guess as the top paying. And did he do it based on like cost of living and stuff, so it equals out?
So he just did pure
Probably
numbers
just
based.
straight
So
up,
he did-
right? It's gotta be
Yeah,
California.
just straight up.
Yeah,
numbers.
California. I'm gonna go with Texas.
California, yes. Texas, no.
I don't know. Is like New York? I don't know.
Think like rural. Think like.
That's why I
removed
thought
from-
Texas. You go to the Valley of Texas, you can pay like $120,000.
Yeah, but there's
Like
most people
Wyoming?
live in the metro. No, Alaska. So like Alaska.
Okay.
Oh, okay.
Yeah.
That makes sense,
So-
right? They're trying to like draw people up there. I've actually talked with a couple of PTs who are like lived in Alaska for a few years and then are coming back, coming to join
Yeah.
in the areas. Since we don't have a Luna presence in Alaska, they're coming back.
Yeah, not yet.
Not yet.
But
California, Alaska, and what's the
California,
third one?
Alaska. The other one was kind of random. New Mexico popped up under his survey.
Probably
So,
like
once again, these are
desert,
yeah.
PT desert.
I
All right,
know-
lowest
I know
paying.
Nevada was up there as well. Lowest paying. What are the top 3? Or what do you think?
I know that when I was graduating PT school in St. Louis, the starting salary for a PT was like $52,000. So I'm gonna go with like Missouri and I'm
Iowa?
like Mississippi and maybe Iowa.
That's what I thought too, and I think they are on the lower end of the spectrum. Like he lists all 50 states, like what the averages were. But on his end, he actually mentioned Wyoming is one of them,
Okay.
North Dakota, and Vermont, which was super random because you'd think the Northeast would be all high. So
Right.
that was kind of interesting. You can definitely pull up the full list on your own because he
I'm
sends out
curious
some for
what
free.
his survey pool was. Like going back to my like stats class in school, I'm like, how many people did he survey? How many people
That's a great
incorrectly?
that's a
You
great
know,
question.
Yeah.
I'd
That
to
and
check,
like
but-
compared to cost of living. So when we were graduating, my friend got a job outside of DC in Northern Virginia, where I was actually from. And she and I were making the exact same amount, me and Houston and her outside DC. But when we calculated factors of like cost of living and where you live, it looked like based on money that I was making $20,000 more than her because of the difference in those things. So that's also definitely something to consider as well. When you're looking at it. And pediatrics also tends to pay pretty low, sadly.
It's like the one
and then-
people want to work in more, right? Like I feel like outpatient, a lot of people like have that in their mind, or like pediatrics. I knew so many classmates who were like, I'm going peds, and they like went that and were really like tunnel vision on that. And not typically people were like, I want to do home health or skilled nursing. Not typically, at least in the colleague or in the cohort that I had.
Yeah, it's funny that Marcy mentioned that because he actually compiled a map of the US and then he broke it up into 4 categories. First category was above average pay and above average cost of living. Second was below average pay and below cost of living. Third was above average pay and below average cost of living, which is kind of where you should look at if you want to maximize earning. And then the 4th category was below average pay and above average cost of living, which
want to avoid that.
No-go zones. But a lot of those states in the South were those below average pay and below cost of living. The green states were the ones that were above average pay and below cost of living, which Texas I was happy to see on there.
How's
New
Ohio?
Mexico, Arizona,
Ohio.
Ohio.
I'm curious.
Yeah.
So Ohio says below average pay and below cost of living. So I don't know. What do you think, Katie? Is
I
that
feel like
maybe-
that might track. Yeah. Like I
Okay.
said, coming out of school, I was like, all right, this is starting salary. Like you're like, just go with it.
Yeah, and then a lot of the Northeast were surprisingly below average pay, but then above average cost of living. So it looks like if you want to be a PT in the Northeast, probably not the best place to be if you're trying to pay off loans and maximize your dollar worth, right?
Yeah.
But yeah,
Join you guys in Texas, right?
yeah, yeah. There's room. There's room for now. You know, a couple of years I might change my answer, but
I also think
But,
I guess it depends on where. Austin's probably very different now than it was before, but you can definitely, I mean, Houston is definitely very cost of living. It's on that lower side comparatively to big cities. But yeah, you can make a ton of money if you go rurally, very accurate. I think in general, healthcare is, because of the nature of it and reimbursement, you're getting healthcare deserts in a lot of areas. And so that's where the travel, all the new interest in travel comes in, but you get more money there. I've seen salaries for like New York, around that area, like 100K. And that number sounds big to you. And then you think of what it actually costs to live anywhere over there. And you're like, that does not track.
no.
Yeah. Yeah. So I would say just a big takeaway today, you know, as PTs, I don't think any of us necessarily get into it for the money, right? We want to help people. We want to use our skills and knowledge, learn more about the body, and use that to make people's lives better. So I think most of us in healthcare go into it for that. We want to help people. And, you know, as PTs, love the consistency of treating our patients. But on the same token, we have to make sure the dollars and cents work, right? You want to live a life where you're able to work and comfortably live and support your family and all of that. So considering things like where you opt to go to school. And I don't think we mentioned it yet, but like, is there a big difference in payout from somebody who attended one university versus another? I don't think so, honestly. You know, it's your experience, you know, again, having a great collegiate experience, learning a lot, but there's so much learning you do after school as well. So again, just taking all of that into account. Yeah, making sure the dollars and cents line up, not burying yourself in student loans for most of your adult life. And yeah, just being able to make everything add up.
And I've told students this before who have asked for suggestions on PT schools and how to get in is the title or the name of the school doesn't matter as much. What matters, in my opinion, is really the passing rate. So they share that every single year, their passing rate. And most of them are pretty good, but I'd look for a school that, you know, has a first time passing rate of like high 90s, like 99% and 98%, or even 100%. Because the rest of that doesn't really matter. As long as you have your license, you pass the boards, employers are going to want you, right? So try to find a school that is financially soft on your wallet, right?
100%. That's what I tell people as well, that it's really kind of what you take into and what you bring out of it. But also you want to look for passing rate and not necessarily name or rank coming out of anything. And I just give them examples of of people that I know and things like that.
Agreed. All right. Well, another great episode today of Luna Unscripted. If you guys out there have any good financial tips and tricks related to PT school or life after PT, let us know. And always remember, Luna is a great way to earn extra income supplement even on top of your current role. So looking into us in your city is a great idea.
Thank you for listening to Luna Unscripted.